In addition to utilizing standard precautions, there are other ways to keep you and the children in your care safe. Programs should also do a daily health check or screening of children. Each child's day should begin with a simple health check. Now, this is a quick way to make sure the child is healthy enough to be in your preschool or in your child care program. So, most children occasionally get a runny nose, a cough, or a mild fever. Now, this usually causes little worry for teachers and families. However, sometimes a child's illness can become much more severe, and programs should have policies to guide decision making when dealing with ill children. Because you know the children in your classroom well, you can most likely tell when a child in your care is well enough to participate in activities, and you should also be able to recognize when a child is too sick to stay in the preschool program. Now, your program should have guidelines to help you make this decision. It shouldn't be something that you just have to think of yourself. Now, the American Academy of Pediatrics offers 3 key factors in deciding whether a child is too sick for childcare. One of the factors is the child cannot participate in activities. The second factor is the child's illness presents a risk to other children or staff. And the third is you cannot care for the child while maintaining appropriate care for the other children. Now, if you think a child meets any of these criteria, it's likely that they should be sent home. So, daily health checks are a good time to evaluate a child's health to make these critical decisions. So remember, it is up to you, or I should say up to your program, not the family, to decide whether a child is healthy enough to stay in child care. You must consider the health of the other children and your staff in your program. So, health checks also provide a record of any changes in a child's appearance or behavior, which actually can be important if you suspect child abuse or neglect, because we are mandatory reporters. This information can also be useful for families if the child is suspected of having a long-term physical or mental health need. Health checks, if conducted sensitively and documented thoroughly, can also help you build relationships with children and families. So, what is a health check? A health check is a quick evaluation of a child's body, their mood, as well as their behavior. As part of your health check, you should also gather information from families, from the families. You want to know, first of all, if there are any health changes that could affect the child or family members. And you can ask a simple, is everyone feeling all right today? That's something that you can use to start the conversation. And as you get to know a child well, you will quickly notice any differences from day to day. Now, the purpose of a health check is to notice any illnesses or health concerns the child might be experiencing at that point. So, when should you do a health check? You should do a health check each morning when a child first arrives. Ideally, health checks should be done, or I should say completed, before the parent or the guardian leaves the building. Now, this will give you a chance to talk with the parent or guardian if you have any suspicions that the child is ill, or if you have questions about any changes in the child's behavior, appearance, or mood. And you should also do a health check anytime you notice a change in the child's appearance or behavior. Now, you might do a series of health checks across the day or throughout the day if you suspect a child is not feeling well. Now, the results of a health check should be documented. Documentation is so important. So it should be documented throughout the day. Document any problems or changes on your daily health check form. If you think the child is ill and should not be in child care, talk with the parent or guardian immediately before they leave the program. This will allow them to make alternate plans. So, whether or not you see a problem, it is important to document daily health checks. Record that you did a health check each day and mark anything unusual for the child or family. Now be sure to save this documentation for at least 30 days. In the event of a disease, some type of disease outbreak, these records can be very useful to your program and public health officials. Now, your program's exclusion and readmission policies should take into consideration the health of the child, other children, staff, and the needs of the family. It's important that you adhere to your program's policy and help families understand your program's health-related expectations and requirements. Your administrator is responsible for determining whether or not a child needs to be excluded from child care for health reasons and for how long. It's your responsibility to know the conditions and symptoms that do not require exclusion, the criteria for the exclusion of ill children, and the procedures for a child who requires exclusion. So, contrary to popular belief, excluding a child with a mild illness is unlikely to reduce the spread of any type of germs or any type of disease, as most children spread germs before or after their illness or don't exhibit any symptoms. However, if a child is sick and the decision is made for them to be sent home, remember to respond sensitively to the child and to the family. The family should be contacted right away and asked to pick up their ill child. When a family member or guardian arrives, describe the symptoms. You already have your documentation, and provide any documentation the family might need to give to a doctor. Include when you noticed the illness, a description of the symptoms, any vital signs like their temperature, and any medication that you provided that were prescribed by a physician and previously approved in writing by the family, or other action you took. Also, remind the family about your program's policies and when the child can return. Your program is designed to help promote healthy practices. So, take some time to learn about your program's policies and facilities for sick children. Have a good day.